Well, thank you. I very much appreciate that because it really means a lot to me. Director Jeppeson's here, but my entire legislative career, if you look at everything we want to do in Idaho, there have been two items that continue to grow somewhat unplanned, and that was Medicaid spending and corrections expenses. And as I was in the legislature and then lieutenant governor, and then now in my job is I make recommendations on priorities to the legislative branch. It was abundantly clear to me that my goal was that we want our kids to stay in Idaho, the ones that left to come back, frankly, doing real good there. It seems like everybody's coming back to Idaho right now. but a lot of it is in Magic Valley is prominent in the creation of jobs and opportunities. But now a lot of it's about quality of life. And so as I worked on all these projects, whether I was in the legislative branch or the executive branch, it became obvious that there's a lot of things that we need to do. And I want to give credit to the judicial branch. They came to Director Jeppesen, Dave Jeppesen, your Director of Department of Health and Welfare, and we are very blessed that out of our 5 Supreme Court justices, 3 of them have been very involved in drug courts, mental health courts, problem-solving courts, and we went to the legislative branch, and all 3 branches, and I believe we're the only state where all 3 branches have come together, and this is the document that they have come up with. Idaho's Behavioral Health Council's 2021 to 24 Strategic Action Plan. And if you haven't seen this, it's on Director Jeppeson's website, and it's available. But a lot of things you're going to talk about are part and parcel of this graphic. Surely on, I know it's in the book somewhere. Of this graphic right here, of all the different parts that are promotion, prevention, engagement, treatment, and recovery. And the committee really did a good job on this. And there's actually an action plan with timelines in it. And literally all those resources, there's a chart that's available at Health and Welfare that talks about what we need to do. Your meeting here is part of that, but we all know that recovery, substance abuse, mental health permeate everything we do in Idaho, whether it be our correctional systems, our courts, our hospitals, social services, schools, and many other areas. When I talk to educators, they always, what are we doing about teacher pay? What are we doing? But when I bring up the issue of behavioral health, uniformly, teachers from one end of the state to the other, that is a big challenge. And these dedicated classroom teachers will tell you that one of their biggest challenges is all the different challenges that these kids have, and what do we do to help them? And so we put money, the legislature put money into behavioral health, we'll put more money into it as we go forward this year. And then simultaneously with that, we put together my opioid and substance abuse disorder advisory group, and they're making recommendations to us. And we're just trying to tie all these things together so that we either don't stumble over in state government, local government, and private entities and faith-based groups. We don't stumble over ourselves, but we leverage what we've got with what we need going forward. And of course, simultaneously with that, we've got what are we doing on implementing Medicaid funding going forward. That really has given us a lot of runway in a lot of areas where we needed it going forward. And John talked about our crisis centers that we put out regionally, and then the recovery centers. And of course, I'm from Emmett, and so something I'm passionate about is how do we scale it out to rural Idaho? Twin Falls, Pocatello, Idaho Falls, Boise, Coeur d'Alene. It's obvious we're going to have areas there, but how do we scale out to these rural communities, whether it be remote delivery or hooked onto a hospital, hooked onto whatever's there. And we do know behavioral health is best when it's done regionally, but we want to coordinate it. And that's what our goal is out of the 7 regions, whether it be with the health districts, whether it be with the hospitals. One of the things on the correction side, which Commissioner Renke knows a lot about, is what we've done, what we started doing in corrections, and we continue to ramp up our investments in connection and intervention stations, and what we're doing there. But before I became governor, one of the directors that came after Brent was there, who was there, they basically, they were saying at that point in time we needed more space in our correction system. And I said, show me a troubled, early, preschool, early K3 child, and then show me the inmates we've got, that are lifers, and show me all the on-ramps and off-ramps. And where do we deploy money at each stage to try and stop the continued expense that we have, and how do we get in early? How do we identify these problems early and then best take care of that problem? When Brent was there, we always talked about our recidivism rate and what we do about that. And that's been part of the plan, and that's what's in this document. How do we coordinate those efforts? And the Behavioral Health Council has put together a great plan. We originally thought it was going to be a temporary, we're just going to get everybody together, say what we've got, and then maybe go on our merry way. But it became abundantly obvious that this is there's a big enough need and a crying need for us in the state of Idaho to continue with that coordination, particularly from the 3 branches of government. We've got the legislative representation. Dave and Sarah from the judicial branch are the chairman of it. But if you read this document, I think you will find the recommendations are spot on. But that doesn't mean we can't continue to improve on it. That doesn't mean we don't have more work to do. We've got that Medicaid funding that's very helpful. And then we've got the settlement on these opioid lawsuits that we want to make sure that we fulfill the intent of the judge when they made those orders, that we take care of some of the problems that have been created by substance abuse. We've always had the problem with alcohol and the nexus between the 2 of them. I'll tell you a cute story. When we first started this, I remember we were in my conference room, and I said, I think I read somewhere where it's 65% of the behavioral health have a substance component. And somebody else said, well, maybe like 75. And then somebody said, well, it's more like 85. And I think, didn't we end up with like 90%? The nexus between behavioral health and substance abuse. Well, there's no way you can bifurcate those 2 things. You got to look at them holistically. And I know that's what you're going to talk about here. And because if you do try and run them in different silos, you're not going to get it done right, and you're not going to do it right. So the recommendations in this document, what you're trying to do here, what we're doing to support the crisis centers and recovery centers are going to go a long way for Idaho, for improving our quality of life for everybody. We've come a long way. I went in the legislature in 2001, and we didn't have very many programs. They weren't very well coordinated. Opioid issues. I don't know that the word fentanyl was ever used. There was opioid, and then there was methamphetamine, and now the problems are have been exacerbated from a lot of areas. 20 years ago, the problems that these kids have because of bullying with social media didn't exist. Some of those challenges, life's just got more complicated, and we need to recognize that. And I am very, very hopeful that the recommendations, I see Representative Harkin in the back of the room, the legislature has been very helpful. Representative Likely served on this from the very get-go, and is, from this area is very passionate about it. We really do have a great plan going forward, but it's you and your local community saying, looking at this and saying, what are we doing and what can we do to make this system more efficient? What do we do to where, as early as possible, we can find those people that have fallen through the cracks, and what do we do to leverage all the different resources? If you look in this document, it totals up about $380 million that we spend in one way, shape, or form on behavioral health. If we first start doing that as efficiently as possible, and second, we find those areas where we're too late getting into the game and do some preventive education, help these teachers identify these kids early before they get to be a problem, it's just going to be the right thing for the state of Idaho. John, I want to thank you and everybody, the vendors, and everybody that put this on. I have great hopes for this. Our upcoming budget year, we're going to have some opportunity. Now, a lot of this money is going to be one-time money. And I know that the legislature is going to be interested in putting money into behavioral health, substance abuse, particularly if it'll build capacity. It'll build capacity at the local level to where there's a subsistence to it, that we get a hold of these problems, get ahead of these problems early. And that's my message to you. I just want to thank you for what you've done. It's people in the local communities rolling up their sleeves, helping the kids, helping their fellow man, doing the right thing for their communities. It's going to make this state a great state going forward. So thank you all very much. I look forward to hearing from Lexi and Kayla about what you've done. So thank you very much.